Thank you, Premier. So there were 112 locally acquired cases of COVID in the 24 hours to 8 p.m. last night and 46,478 tests. It's pleasing to see those test numbers remain high, but we have got more capacity. So we're suggesting and recommending a lot more testing, particularly in the areas of concern, so we can flush out any unrecognised cases and block those chains of transmission. Of the vast majority of cases are occurring in southwestern Sydney, southeastern Sydney, and we are seeing a small number of cases in Western Sydney and the Pea and Blue Mountains. I'm going to read out the key suburbs where we have cases, and it is important. The reason I'm reading these locations out is because we do need to make sure that every member of that community understands every time they go out of their house for an essential good, if they go shopping, they need to assume that someone next to them has COVID. Now, everyone across Greater Sydney should assume that, but we are conveying that in these areas, the risk is even greater. So when you are out and about for those very essential things that you need, please limit the time, go directly there and make sure you're maintaining your social distancing, your mask is over your nose and mouth, and that you keep your social distance. The suburbs are Fairfield, Smithfield, Bossley Park, Fairfield Heights, Fairfield West, Wakeley, Bonnyrigg, Glenfield and West Hoxton. Also, I just want to highlight that we are also seeing cases emerge among young adults in the 18 to 20-year-old age group, in the Georges River, Bayside and Sutherland local government areas. And they're largely spreading it again, to echo the Premier's words, to their closest friends and family. So it's crucial that young adults also limit their social interactions at this time and also come forward for testing. In terms of New South Wales Health is also working with residents of an apartment block in the eastern suburbs where we have 8 cases of COVID, and they've been identified in recent days across 5 households in a block of 29 units. We've now identified the source and will be working with all residents to ensure we can safely move and provide care for those with COVID in a special health accommodation and support the needs of all other residents who are close contacts and must remain in quarantine in their homes for 14 days. I just want to express my gratitude to the residents of the apartment block for working so well with us during a very difficult time. But this is a reminder of the risks that COVID poses and why we were requiring masks and have been in indoor common property areas of residential premises, and also discourage social gatherings or any gatherings across household groups in those apartment buildings as well. Just to highlight that, even if you're going to get your waste disposal, other points of contact, please see that as a risk as well, and please make sure that you've got your mask affixed and you keep that social distancing. In terms of the impact of COVID, let me say that we will be collating the information and putting it in our epidemiology report in terms of the underlying health conditions of people that are hospitalised. But I can say that you don't need to have an underlying health condition to be in hospital with COVID. COVID is a serious disease and is associated with hospitalisation in death. Obviously, the risk increases with age and for those underlying health conditions. We currently have 63 COVID patients admitted to hospital. We've got 18 people in ICU, 4 of whom are ventilated. 25 people admitted to hospital at the moment are under the age of 55 and 14 are under the age of 35. Of the people in ICU, we have 1 in their 20s, 1 in their 30s, 1 in their 40s, 5 in their 50s, 6 in their 60s, 3 in their 70s and 1 in their 80s. Again, dispelling the notion that you are not going to get sick from COVID if you're young. But I think the most important message, because no one wants to pass on COVID, No one wants to infect their loved ones. So please stay isolated, get tested if you have the most minimal symptoms. Just to reiterate the Premier's comments, what we are requiring is that everywhere is subject to the stay-at-home provisions. But we're highlighting the increased risk in those areas. So it's Fairfield local government area, some parts of Liverpool local government area, extending into Canterbury, Bankstown local government areas. And obviously I've mentioned those other areas of southeastern Sydney that we're also concerned about. If you need to leave home, it has to be absolutely essential if you live in particularly the Fairfield local government area. Do not visit any other households. And if you're a worker, stay at home unless you absolutely need to attend work. So essential aged care, emergency services, healthcare, other things that are critically essential. If you need to attend work, get tested before you go to work. And you don't need to isolate, but if you can delay going to work until you've got a negative test, that's much preferred. But if you have the most minimal of symptoms, you have to stay isolated until you've got a negative test. If you're sick, please call ahead. Do not go to your general practitioner with respiratory illnesses. Please call ahead and ask about what the care path is best for you. We want to protect our healthcare services and other patients in those healthcare services that are obviously amongst our most vulnerable. Also, if you're going to pick up a script from a pharmacy, or you're going to get Panadol or other pain relief and you've got COVID symptoms, don't do that. Get a test, stay isolated, and ask one of your other household members without symptoms to go in, but go directly into the pharmacy, pick up the medication you require and go home. We don't want to see any other opportunities for COVID to spread in healthcare settings. In regard to the vaccine message, please go and get vaccinated. Please contact your general practitioner, see if you can have bookings for the AstraZeneca vaccine and in some cases Pfizer vaccine, which is available through general practice as well as through New South Wales Health. If you've had the AstraZeneca vaccine within the last 4 weeks, we're asking that you ring your GP and they may be able to bring forward your booking to that 6 to 8 week period. Now, clearly having the vaccine within the 6 to 8 weeks trades off the duration of protection that vaccine might provide you, but we know that into the future we will be providing booster doses of various vaccines, and what we want to do is protect you. But my other message is even one dose of vaccine is worthwhile in improving your likelihood of hospitalisation. So please, even though the 2 doses is much more effective, even going forward and booking your first dose, we do want you to be patient to general practice, and general practice will try and meet those booking requirements, but we know that they will be prioritising the elderly as they work through. So if you are younger, please be a little patient with your general practitioner, but I would urge everyone to take up every opportunity to get vaccinated at this time.